Imagine your body's ultimate defense system, right? Like a highly trained, microscopic military suddenly sounding the alarm. They're mobilizing troops, handing out weapons, and going to absolute war. But when the dust finally settles, there's literally no enemy to be found. They're fighting a ghost. Welcome to this explainer, where we're going to unravel one of the most fascinating and honestly kind of puzzling medical mysteries in human biology. Okay, let's dive into this and look at the mystery of sarcoidosis.
To really understand what we're dealing with here, let's break down this somewhat intimidating medical term. So, sarcoid basically refers to flesh, and osis means disorder. Put them together and you've got a flesh disorder. It's an immunologic condition where your body forms all these little small nodules everywhere. The disease itself is, well, it's pretty poorly understood by modern medicine, but the data does tell us exactly who is most commonly affected. It actually presents most frequently among African American females. But, to truly grasp why these little flesh nodules are forming in the first place, we got to shrink down. We need to look at how our immune system normally operates.
Section 1. The flesh disorder, fighting a phantom.
Let's see how our microscopic police force responds when they're faced with a real threat. Normally, the trusty cells of your immune system are always out on patrol, ready to spot and destroy any foreign pathogens that could hurt you. The primary detectives in this system, they're called antigen-presenting cells, specifically the dendritic cell. I absolutely love that name, by the way. It comes from its long, beautiful, branch-like arms called dendrites. When a dendritic cell finds a bad guy, it uses those arms to pull the invader in and just swallow it whole. Then, it breaks the pathogen down and proudly presents a tiny piece of it, an antigen, on a special molecular tray called an MHC class II molecule. It's basically showing a mugshot. Now the detective needs an army, so it travels to a lymph node to find a naive helper T cell. Think of this as a brave little soldier that has literally never seen combat before. Once that T cell recognizes the antigen mugshot, it activates. Finally, these activated T cells leave the cozy comfort of their lymph node, head straight to the front lines, and start secreting pro-inflammatory cytokines to recruit heavy backup, like more T cells and macrophages. It is a perfect, flawless biological cascade.
And this brilliantly illustrates the dramatic irony of sarcoidosis. In this disease, that beautiful, flawlessly coordinated immune cascade we literally just looked at, it unfolds over and over and over again throughout the body, but there is absolutely no specific pathogen there to destroy. The body is trying its hardest to eliminate a threat that simply doesn't exist. The immune system just goes completely haywire in the absence of an invader.
So, you're probably wondering what trips the alarm in the first place. If there's no bad guy, why on earth did the police show up? Well, there are a few potential triggers. First off, we've got genetic risk factors, like having a family member with sarcoidosis or being African American, as we mentioned earlier. But then there are the environmental risk factors. Sometimes the patient had a prior infection with Mycobacterium tuberculosis, that's the bug that causes TB, or Borrelia burgdorferi, the one responsible for Lyme disease. But here is the absolutely critical part you need to remember. By the time this autoimmune chaos actually sets in, those initial pathogens are long gone. The original spark faded out a while ago, but the immune system, it just kept building the fire.
Section 2. Anatomy of a granuloma. Building the fortress.
Let's see what happens when millions of these hyped-up immune cells create a massive, microscopic traffic jam inside your healthy tissue. As more and more of these cells gather in one spot, they form these small, dense nodules called granulomas. Often, this happens in the hilar lymph nodes, right where your bronchi meet the lung. Now, what's really interesting about this slide is the medical distinction between types of granulomas. In a disease like tuberculosis, the granulomas are what we call caseating. That means there's dead, necrotic tissue right at the center of the nodule, because there's an actual deadly, real-world battle going on. But in sarcoidosis, the granulomas are non-caseating. There's no tissue necrosis at the center. It's literally just a tightly packed fortress of immune cells guarding absolutely nothing.
Let's map out the anatomy of this bizarre biological fortress. So, on the outer edges, the periphery of the granuloma, you have the T cells standing guard. Right in the center, you have the macrophages. But things get super weird in the middle. Often, these macrophages actually fuse together to form one massive multinucleated cell called a Langhans giant cell. And inside that giant cell, you'll find Schumann bodies, which are essentially just little deposits of calcium and protein. But my absolute favorite detail from the source material is the asteroid bodies. Inside these cells, doctors find these tiny star-shaped structures, and science still doesn't entirely know what they're made of. It's highly controversial. Some scientists think they're broken pieces of the cell's cytoskeleton, while others argue they're made up of lipids. I mean, think about that. Your body is literally building microscopic star-filled fortresses to trap a ghost. It's wild.
Moving on to Section 3. System-wide collateral damage. So these microscopic fortresses don't just stay invisible. Sarcoidosis is a systemic disease. That means these granulomas aren't just forming in the lymph nodes. They can show up in nearly every organ in the human body, turning all this cellular chaos into very real, very tangible symptoms for the patient. In the lungs, this causes coughing, shortness of breath, and bilateral hilar lymphadenopathy, which is just the medical term for the enlargement of those lymph nodes we talked about earlier. On the skin, patients can develop erythema nodosum. These are red, hard, incredibly painful nodules that pop up on the lower legs along the tibias, caused by inflammation of the fat within the skin layer. It can attack the eyes, causing uveitis, which is an inflammation in the pigmented layer beneath the cornea. It can even take root in the heart, leading to dangerous arrhythmias. Add in generalized symptoms like fever, fatigue, and weight loss, and you can really see how devastating this false alarm is to the person actually experiencing it.
Section 4. Investigating the clues. Diagnostic Toolkit.
So how do doctors actually solve this? Well, clinicians have to play detective, piecing together the clues left behind by this rogue immune army. This diagnostic matrix breaks down their toolkit for us. A chest X-ray or CT scan will usually reveal that bilateral hilar lymphadenopathy. Blood tests are going to show an increase in an enzyme called ACE, or angiotensin-converting enzyme, which is pumped out by all those overactive T cells. Doctors might even use a procedure called a bronchoalveolar lavage. That's where they pass a bronchoscope into the lungs, squirt some fluid, and recollect it, just to find massive, elevated levels of T cells hiding out in the lungs. So the crucial point is this. While all these tests provide amazing clues, the absolute best, most definitive way to diagnose sarcoidosis is to do a tissue biopsy. You literally have to physically look at the tissue under a microscope and see those non-caseating granulomas with your own eyes.
But I want to pause for a second on one incredibly surprising finding from those blood tests. Patients with sarcoidosis typically have increased levels of calcium in their blood. Why? Because the macrophages trapped inside those granulomas are actually producing excess vitamin D. The immune cells, in their totally confused, hyperactive state, end up accidentally overdosing the patient's body with calcium. It's a fascinating, if, slightly tragic irony of a body trying so hard to heal itself that it just ends up causing more chemical imbalances.
Let's jump to Section 5, Treatment and Resolution, Ending the War.
So how does a war against a ghost actually end? You'd think a system-wide immune malfunction like this would require massive, lifelong medical intervention, right? Well, let's see how this builds to a rather surprising resolution. For people with minimal symptoms, no treatment is needed at all. Most of these symptoms simply resolve spontaneously within just a few weeks. The immune system eventually just kind of seems to realize its mistake and stands down. Complete remission from sarcoidosis typically happens all on its own within a few years. Now, of course, if a patient has severe symptoms, like those heart arrhythmias or debilitating lung issues we mentioned, doctors will step in with steroids to force the immune system to calm down. But in most cases, the body's internal fire simply burns itself out.
We've seen how a phantom threat can mobilize an entire bodily army, build microscopic, star-filled fortresses, and cause system-wide chaos, only to eventually fade away like it never even happened. It is a true testament to the raw, untamed power of human biology. And it leaves us with this final thought for today's explainer. If our immune system can build such stunningly complex biological fortresses to fight against ghosts, what else is it capable of doing in the shadows? Thank you so much for exploring this with us, and stay curious.